be treating Prozac. Don't forget that this is just an highlight introduction to what Prozac does. If you need more detailed content review, you need to do some registration by going to our website to register for the detailed review. So what are the generic name, or what is the generic name of Prozac? Prozac is otherwise known as Fluoxetine. What drug class does it belong to? We call it selective serotonin reuptake inhibitor, which is the SSRI. We need to know the mechanism of action. What it does is that it works by blocking the reabsorption or the reuptake of serotonin into the neurons, so which makes more serotonin available in the brain synapse. And this is going to help the patient to maintain their mental balance and also to improve their mood. So it is important to know that Prozac is one of the very first SSRI that came out in 1987. It is also this one of the SSRI that has the longest half-life. It has the longest half-life. When we say it has the longest half-life, it's going to stay in the system for a longer time. So with this now, it's going to have a very low risk of discontinuation symptoms. For the sake of the exam in board, so it is important to know that Prozac is what? An inhibitor of CYP2D6. So again, when we say something is an inhibitor, a medication is an inhibitor, what it does is to increase the dosage or the blood level of the other medication we are using in combination with this medication. So if peradventure we use Prozac with another medication, for example, a TCA, what it's going to do is to increase the level of TCA. If we use Prozac with beta blockers, it's going to increase the level of beta blockers. If we use Prozac with antipsychotic medication, it's going to increase the level of antipsychotics. So very important, you should know that Prozac is an inhibitor of CYP2D6. It is also important to know that it requires a longer washout period. If peradventure we want to switch Prozac from Prozac to another antidepressant, we are going to wait for the period of 5 weeks. We have established that it has a longer washout period. Don't forget, for Prozac, what is the washout period from switching from Prozac to another antidepressant? Basically the period of 5 weeks. So let's go to indication. What are the uses? Who are the people that need to use Prozac? It is FDA approved in the treatment of several conditions in adults, in some cases for children and adolescents. So let's list them. Major depressive disorder, we can use Prozac to treat anyone from age of 8 and above. In obsessive compulsive disorder, OCD, we can use Prozac to treat from age 7 and above. We also use Prozac in the treatment of bulimia nervosa, which is our eating disorder. It is important to know that Prozac is the only SSRI that is FDA approved for the treatment of bulimia. I'll repeat that for exam purpose. Prozac is the only SSRI that is FDA approved for the treatment of bulimia nervosa. We go further. We also use Prozac to treat panic disorder. It is used to treat premenstrual dysphoric disorder, which is our PMDD. It's also used to treat depression associated with bipolar disorder when used in combination with other antipsychotics, especially olanzapine. It is also very important to know that we can also use Prozac as an off-label medication in the treatment of PTSD, post-traumatic stress disorder, as well as social anxiety disorder. What do we mean by off-label use? Off-label use is that practice of prescribing medication for a different purpose than what the FDA approved it to be used for. So we can say basically non-official use. So unofficially, we can use it to treat PTSD or social anxiety disorder. Let's go to the side effects. So basically, it is having all these side effects I'm going to mention: nervousness, tremor, jitteriness. Patient can have nausea. You will see them having trouble sleeping. We have just said initially that it's an activating medication. So patient is going to have trouble sleeping, headache, fatigue. Don't forget, they always have some sexual dysfunction in form of a reduction in their libido, as well as dry mouth. It's also important to know that Prozac or Fluoxetine is an activating medication. It makes some people to feel more alert and agitated. So taking this medication in the morning is very important, because it helps to manage this stimulating effect so that the activation can be felt during the waking hours and it's not going to interfere with the sleep of the patient at night. So with the dosing, we always want to start with a low dose, and we are going to be going slowly. So it is better to start low and go slow. We always express this to educate students, for them to understand that we start low and we go slow, and we dose in the morning so the patient will not have trouble sleeping at night. So just want us to know that this is just an highlight. It's just an highlight to what we are expecting you to know. If you still need to have more detailed content review, kindly visit our website by registering at www.advancednp certification review. I'll state that again. Kindly visit our website for registration at www.advancedmpcertificationreviews.com or call our number, send a WhatsApp message to 281-372-9148. This is Dr. Kemi Akinlawo again. Thank you and God bless.